Mr. Speaker, I rise today to recognize the House's work that aims to improve outcomes for children with complex medical conditions. As a physician, I've delivered more than 10,000 babies and seen firsthand many of these complex and complicated conditions, often when babies are born prematurely. Today, there are 33 million children dependent upon Medicaid in our country. 2 million of these cases are considered medically complex. It's imperative that we take a compassionate look at the way in which this care is being provided to some of our most vulnerable patients. And I'm proud of the legislation the House recently passed to address the way the care is provided for these children. Last week, we passed the IMPROVE Act with overwhelming bipartisan support. This legislation included the Advancing Care for Exceptional Kids Act that aims to put our nation's sickest kids and their families first by improving their care. These children and their families already face many challenges. Thus, our healthcare system has to work with them by making access to care more manageable and easier to navigate. Too often, these children are forced to see multiple doctors, sometimes requiring them to go across state lines for treatment. This can be both costly, time-consuming, and confusing. This bill reduces the burden on families by no longer making them jump through hoops for their children's coverage. The ACE Act also ensures that each child gets the coverage they need by helping hospitals coordinate across state lines and provides additional resources to families to help them navigate the health system. This coordination will likely reduce emergency visits and inpatient hospitalizations and ultimately lower the overall cost of care for these children, while at the same time provide for better outcomes. In Kansas, 41% of children with special health care needs are covered by Medicaid. I appreciate the opportunity to make Medicaid a more caring, comprehensive, and efficient system for each and every child with this serious